Hey, good evening. Welcome back to Chapter 18, Social Insurance. Just wanted to kick it off by saying that we've been focused a lot on the private insurance products that are out there that people buy, that the private sector carries. There are some pieces of or some requirements that can't be covered by the private insurance, and they actually have to be government based. So we're going to cover those in Chapter 18. This is a little bit of a lengthier chapter, so I'm going to break it up into a couple smaller segments, maybe 25 to 30 minutes each. But hopefully you'll stay with me. And let me get started and I will share my screen with you all. Okay, talk a little bit about social insurance. As I mentioned, insurance, usually what we mean by social insurance, it's established primarily for the public good. It's overall social good. It's essential protection for the entire economy. It's usually established by a government, whether state or federal. Most social insurance programs we all are required to participate in, whether we ever receive any benefit or not. We really don't have a choice in the matter. It's the only way these type of programs would typically work. So what are the reasons for having social insurance? First being that social insurance is necessary because it involves complex social problems like unemployment. We're going to talk about that. Failure for people to save enough money for their own retirement, people who would live on welfare or need public assistance. And so we're trying to establish some level playing ground or a certain amount of established baseline income for everyone. It covers things that typically are perils that wouldn't be covered or would be difficult to insure in the private sector, like unemployment, like workers' compensation, or Social Security income or disability. Those are all things that typically need to be covered by a government type program, and a for-profit entity wouldn't take them on. It also provides, like I said, some economic security to the overall population, especially during hard economic times like we're dealing with right now. It gives a baseline for the population protection against long-term financial consequences like premature death or old age or catastrophic exposures like unemployment or having a major disability in the course of your life and not having financial resources to cover your family. So what are the basic characteristics of social insurance is they are mandatory or compulsory, as we would call them. You're obligated or mandated to comply or participate. That ensures that whether you have a lot of money and don't need these programs or not, you still are required to participate, and that kind of evens out and prevents some adverse selection, which means that only those that are high risk would participate. There wouldn't be enough money to sustain them. They are designed, like I said, to give a baseline or floor of income. It's definitely not meant to make people comfortable. It's to provide them with a certain amount or basic level of standard of living. It meets the very, very basic needs, but it is definitely not something, they're still going to potentially need public assistance or welfare to maintain them over a long period of time. These programs are designed for social adequacy rather than individual equity. So again, not everyone will ever benefit from these. Some people have enough of their own financial resources. They will never actually go after these type of resources or don't require the use of them. Whereas those that are most in need, those of low income, typically will take away more value and more benefit than they'll ever put in. So they get more out of it than they give, whereas some people will do the opposite. It's not going to give equity to every economic or social group in the economy. Most of the benefits are loosely related to earnings. So a lot of times you'll get more based on what you earn, but then as we'll talk and going through some of these different types, you don't always get a bigger benefit. It actually is scalable. So if you make less money, you're going to get a bigger percentage of it. It's going to cover a larger percentage of your income or replace it. Whereas if you make a lot of money, using Social Security as an example, you're not going to get as much as, it's not going to cover as a larger percentage of your income as you would if you made less. You don't necessarily have to require, or you're required to meet a specific means test. Like you don't have to prove that you're of low income to get it. So it doesn't matter how much money, you could be a millionaire and still claim Social Security benefits. You could be disabled and be a millionaire and still collect disability benefits from the government. You could have a lot of money and make a great living and still obtain unemployment insurance. So you don't have to prove that you have a need, but definitely there's sometimes that you, for example, public welfare and public assistance, those things do require that. Full funding is not necessarily going to occur. So obviously it's not a good financial solution if you can't provide enough resources or revenue to come in to cover your expenses, but it's not required. So what we know is Social Security is not fully funded. We've all heard that, where maybe more people are drawing out than are putting in, and so it'll become defunct or unsustainable over a period of time. When it was established initially back in the 1930s, the intent was for it to be financially self-supporting. That is not the case, but they are designed that way, and over time, those things have had to be supplemented with government assistance, and they're going to have to reevaluate that, as we'll talk about later in the chapter. So the first one we'll cover is OASDI. You may or may not be familiar with it, but you may have looked at your payroll check before and go, what in the world is OASDI? Why do I have it withdrawn from my payroll check? Essentially, it stands for OA, stands for old age. We have survivor benefits as well as disability insurance. There is a fourth item that's covered under OASDI, but it's usually covered in a different line, and that's Medicare, which we'll cover here in a minute. So these are commonly known as Social Security. When you are collecting your old age retirement funding, that's called Social Security. Also, if your parent dies at a young age and you are still a minor, you could actually collect Social Security as a survivor or a spouse of a survivor. If you become disabled before the age of retirement, or you get hurt not related to work, you actually can collect disability insurance. So it's like a premature collection of your old age insurance. You actually are eligible for it sooner rather than later. So the original reason this was enacted was 1935, after the Great Depression, Great Recession. It was put into place to provide some economic stability. It covers most workers out there. 9 out of 10 are typically covered. There's only a few people that are not covered by it or don't pay into OASDI. They may be covered by another state or federal program. Virtually all private sector employees and most of the state and local are covered by it, however. Federal employees were not covered by OASDI until after 1983, so not everyone was covered. So in order to become eligible for full benefits, you actually have to acquire credits. You get a credit, it's actually based on a dollar value. So one credit in today's dollars would be $1,360 per credit. You can only earn up to 4 per year. So the most you can earn in 1 year or gain credit for is up to $5,440 per year, those 4 credits. And so obviously you're going to have to work a minimum of 10 years to attain 40 credits to get full insured status. Not having full insured status does not mean you can't collect monies, though. You can be currently insured and actually collect survivor benefits if you're younger. You have to have at least earned at least 6 credits, so maybe a year and a half of working, or your parent has worked a year and a half, or spouse, in the last 18 or 13 calendar quarters. So somewhere over the last few years, you've been gainfully employed. So the number of credits you receive depends on your age too, so to get disability. So if you get disabled at the age of 19, it's a lot different than being disabled at the age of 40, and you'll have different credits accumulated. So you'll earn more the older you get. And there's probably a max amount that you can get. So the duration of work test must be satisfied before you can qualify to get the monies, meaning how long have you worked? Have you been working consecutively for a period of time and not been just collecting unemployment before you can collect some of these benefits? So the old age part or retirement side, the ones that we're most familiar with hearing about, Social Security, this is where you do not have your own private, like we talked about in the last chapter, a retirement plan where you've saved your own funds in a 401k, or your employer has provided you a defined benefit plan. If you do none of those things and you fail to save, Social Security was meant to come in and help people that don't have funds set aside for retirement. Again, very low standard of living. It's not meant to be a glamorous lifestyle living off of Social Security. Most people on Social Security have a very fixed income and can barely make ends meet. So it's always good to have a supplement. Relying completely on Social Security is definitely not a good thing. It actually started in 1935, about the same time that you're talking about the Great Depression, a little thereafter. So if you were born before 1937, you got full retirement benefits starting at age 65. And they gradually realized, okay, that's not going to work, and people actually live longer than that. So full retirement age was gradually increased to age 67. If you were born after 1960, you would not be able to retire before the age fully until the age of 67. However, anyone, no matter, regardless of when they were born, they can choose to retire at age 62 based on actuarial tables that tell them how long their expected life is from 62 on. So it definitely cuts down on the amount of funds they'll collect. And it actually goes down proportionally based on your age too. So monthly benefits are typically tied to how much can be paid to a retirement worker, and those monthly benefits are paid either to the retiree or their dependents, like their spouse or any surviving family member that may be eligible to collect, like a disabled child. Here, this table just shows you, like, if you were born before 1937 or earlier, you could retire fully at age 65, and then it sort of phased out, and then came along 1960 and after, the earliest you could retire is 67. If you decided to retire, if you were born in that 37 and earlier at age 62, you do take a monthly reduction in your benefit. The most you would have be reduced is what you would have gotten if you retired at 65. You'd lose 20% monthly for that by retiring early. If you are older and you decide to retire at 62, obviously you're going to live longer. Longer life expectancy, you could actually lose up to 30% of your monthly income benefit by retiring those 5 years earlier. Again, retirement benefits are loosely tied to your primary indexed monthly earnings. So obviously those who make more money are going to get not going to get quite as much as someone who earns less. So if you earn like $30,000 a year, you're going to get a larger percentage of your expected income in Social Security. It's going to cover a larger percentage versus somebody who makes $150,000 a year. They're going to pay into Social Security, and they're still going to get a much smaller benefit than what they actually make. So as an example, the book it talked about, Social Security typically replaces about 58% of your earnings if you're a low income worker. And I'll show you in a minute what you would get as a low income worker and how much money you actually collect from Social Security. If you're in that middle class, medium income worker, it's only going to replace 43% of your income. If you're a high income earner, it's only going to replace, Social Security will replace 36% of your income. And if you're a high income earner, it's only going to replace 29%. So again, every year it's indexed up based on the cost of living adjustment. And so it also depends on how much you earn. So this is to give you an example, and these are indexed up each year. So starting in 2012, it shows how it's indexed up by 2090. What you would make in 2012, it's indexed up quite a bit. But you notice that in 2020, it's only if you're in that low income earning range, right here, you retire at this age, it shows you in 2020, you're only going to get about $12,481. But if you're a low income earner, that's probably a little more than half of what you would make. So someone might make about $23,000 or $4,000 a year. So that's more than half of what they normally would earn. Good substantial portion. If you're a medium income earner, 40% of your income would be replaced. $20,000 might be replacing 40% of your income. If you are a higher income, it's only going to replace a third of your earnings. So, 27,000, that's assuming you make about $80,000 or a little bit more than that. It's going to replace about a third of your income. And then in the highest end, it's only going to cover 26% of your income, and you're getting about $33,000 a year in 2020. So the higher up you make, the smaller proportion of what it's going to replace in your income. But it's good to know that it does replace some of your income. Each year that you work actually adds on additional earnings. So if you choose to work beyond age 62, you're going to get more. If you work to your full retirement benefit of age 67, you're going to get, a good amount, 66, depending on what age you are when you can retire. And then if you decide to work the longest you can work, you could delay your retirement and get additional credits, but only could do that up until age 70. And then you actually won't receive anything additional. But you do get a nice benefit by waiting those 3 extra years. Cash benefits are automatically adjusted, like I said, for cost of living. And the program has an earnings test that can result in a reduction of your monthly benefits if you have over a certain amount. So just to give you an example, let's say you were eligible to retire at age 66, and let's say at age 66 you're going to be eligible for $1,000 a month. If you choose to retire early, this is going to show you that you're going to make 25% less. You're only going to get $750 a month. If you decide to delay it, you're going to get a nice healthy increase by waiting 4 more years to retire. So, it may be beneficial if you're a healthy individual, maybe worth waiting. If not, and you want to go ahead and cash in, you can start collecting earlier. So that was retirement income. Now let's talk about the survivor. If you were to die unexpectedly and you didn't have life insurance for your family, this is essentially a way to cover your survivors. And although it is not a full replacement of your earning value, like we talked about with life insurance, it is something that you shouldn't sneeze at. It's definitely going to help your family, especially if you're a young family. So they can be paid. This benefit is paid to your survivors. If you are killed, doesn't matter whether it's work related or whatever, you are deceased and you're currently insured. Let's say, assume you're working, but you are insured because you paid into your Social Security over the years, and so is your employer. Who would be your survivor? These would be any unmarried children that are under age 18. They are eligible to claim a benefit. Also, any unmarried disabled children, your surviving spouse can also collect as long as they have children that are younger than the age of 16. So not just your children can collect, but your spouse can also collect, as well as any surviving spouse that is not yet eligible for Social Security, or if they're disabled and they're a little bit younger, they can also collect. And believe it or not, your dependent parents, as long as they're at least 62 years of age, they will actually be able to claim dependent benefits if they are truly a dependent of yours and they rely on you for income to get them through to their Social Security age. So the good news is everybody's eligible, but it's not an unlimited amount. So let's say, as an example, your spouse is eligible for a couple $1,000s a month. They have some minor children that your spouse is taking care of, and then each child, maybe of 4 children, each one is eligible for $1,000 or a total of $4,000 additional a month. They will probably not be eligible for $6,000 a month, but they probably would max out at like $3,500. So it's worth claiming. So your spouse would only earn $2,000, but if you add the children in, she might get an additional, I say she, could be he, could get an additional $1,500 a month by adding in the children. They won't get the full value for each person, but they will get a maximum amount that they can pull out. They also are going to get a $255 payment, which is a lump sum. Really doesn't help as much. I think the original intent when it was created was to help cover some funeral expenses or miscellaneous expenses, but it really doesn't cover a whole lot. So what I mentioned earlier is that you shouldn't ignore the value of survivor benefits. They actually can be quite substantial. So if you were to die at a very young age, let's say you're age 30 and your spouse has a new child, it's 1 year old, this 1 year old dependent, your spouse would be eligible for at least 15 more years until that young child is at least the age of 16, your dependent. And then your child would also have 17 years to collect, because they would be eligible to collect until they're the age of 18. So having those benefits, if you were to actually put those at present value of those benefits in terms of life insurance benefit, that would be almost $475,000 over that period of time. Although it isn't a full replacement of what you could earn and provide for them, it's definitely something that could help supplement them in their lifestyle. So the disability side, so let's assume that you don't get hurt in the line of duty, or at work. This is, you get disabled because maybe you had a car accident or something unrelated to work. And we're going to talk later in the chapter about workers' comp. If you get disabled on the job, that's going to be covered under workers' compensation instead of here. But if you become disabled, you can get paid disability benefits through Social Security. And it'll cover you for, it has to be, a longer period of time, loss of income for a long-term disability, not something short. In fact, there's a 5-month waiting period. If you're only disabled for a temporary period of time, a couple months, you're not going to be able to collect. You at least have to be an extended 12-month or longer expected disability, or something that could ultimately be a terminal illness that's going to or injury that's going to result in death. Can be either a physical or a mental condition that prevents you from being gainfully employed. But you have to be fully disabled, meaning if you can do any kind of job at all, let's say you lose the use of one of your arms, but you still can do some other gainful employment, that does not make you disabled and eligible for this benefit. Who's eligible to get disability benefits? So it's not just the person who's disabled, that's under their full retirement age. Let's say you're disabled at the age of 40, you can collect as long as you continue to prove that you're disabled until you're of retirement age. But it also could be the spouse of a disabled worker or an unmarried child if they don't earn any other money. It could be an unmarried child under the age of 18. They also are eligible for some funds up to a maximum amount for the whole family. Or if you have a severely disabled child, that becomes disabled for the age of 22, that would also cover them. So they would continue to claim benefits that are due you, since you can't be gainfully employed to support everyone. So how are these benefits taxed? Some of them aren't. So if you don't make anything but the Social Security income, it's very doubtful that you'll pay any tax on it, very small percentage. However, if your spouse or family makes a substantially larger combined income, your Social Security benefits will start to be taxable, up to the total of 85%. That's the max typically that is taxable at any one time. And I know a lot of people that are eligible for Social Security are really careful about making sure that they don't work too much because they don't want to pay too much tax. They kind of limit the amount of money that they earn because it actually penalizes them. So how is OASDI financed? How's it paid for? It actually comes out of your payroll taxes that you pay in, as well as what your employer pays in. If you're self-employed, you're going to pay both sides of that. So although it says 2012, it's still the same percentage in today's world. So in 2020, or 2020, in 2020, yeah, 6.2% is what you pay in. That's what your employer pays in. But the maximum amount is actually elevated. Instead of being 110,000, it's closer to 128,000. And it was reduced for a short period of time, but it's back up at 6.2. So that portion's paid. But in addition, you're also going to pay in a 1.45% for Medicare, which we're going to talk about in a minute. That is actually going to cover your medical expenses. So if you're on Social Security, you also can claim medical insurance. Some of your hospital bills are covered. Or if you're disabled, you also can collect Medicare. It's not Medicaid, where you are of low income and collecting health benefits because you're on welfare. This is Medicare for those that are eligible for Social Security. If you're self-employed, you'd have to cover 12.4%, both the employer and the employee portion, unfortunately. So Medicare, this covers your medical expenses it covers most people that are age 65 and older, anybody who's on Social Security, but also would cover anybody who's on disability or eligible for disability, as well as any of their dependents. There's a lot of different plans. We're going to go through them. There's Part A, B, C, and D, and we'll cover how those are funded as well as what choices you have. So under the original Medicare plan, you could elect who you wanted to go provide medical care. You could choose your doctor as long as they accepted a new Medicare patient. You could go to them, they could bill Medicare, and then you would pay whatever is left over that Medicare doesn't cover. So the original, when I say the original Medicare, that's Part A. That is what provides any inpatient hospital stay. That's provided through the payroll taxes that your employer is paying and you are paying, that 1.45% that you match as well. That helps cover any nursing facility that you're in, any healthcare, hospice care, up to 90 days in the hospital. If you actually have to go to a skilled nursing facility, that's going to cover an additional 100 days during the benefit period or year. And then, so it's going to give you care for Part A. You don't have to pay this out of pocket. It comes out of taxes you paid in the past. Part B, however, though, is what you need to cover any physician's fees or any related medical expenses. You could choose not to take this. Maybe you have a private health care and you don't want to pay for this. Most people don't have that, especially if they're over the age of 65. So in order to have this, you pay an additional monthly amount, comes right out of your Social Security checks. You don't have to write a check to the government. They actually deduct it from the amount they would pay you. It's an additional $135.50 every month, and in 2019, that was the amount. So that's going to cover everything like lab, doctor's fees, any outpatient services, if you had to have any testing done. And you typically pay and have to meet an annual deductible just like you would if you were in other healthcare plan. Typically, the Medicare covers 80%, and you pick up anything that's remaining, or the remaining 20%. So some people just choose to go with Part A and B. Those are both for $135 a month. That covers a good portion of it. Now, it doesn't cover your prescription drugs or some other fees. So there are other options. Like I said, Part A is covered by payroll taxes that you pay, your employer pays, and any self-employed pays. And sometimes it's subsidized by the general revenues of the government. And then Part B, you actually have it deducted out of your Social Security check and monthly premiums, and then also that is supplemented by the federal government as well. Part C is another option. So didn't know about this until my parents were of retirement age, but Part C allows you to take the original Medicare A and B and add enhancements. And typically it's at a low cost. So it's a really good value. It's a private health plan. You actually pick a provider, whether it be Mercy or Cox or whatever city you live in, whatever the provider is. And it is still part of the Medicare program. They take whatever you would have gotten with Part A and Part B, and they supplement it with any additional funds that you put in. So why do they do this? Because the medical providers, they get the guaranteed service through their hospital. They get more of the funding. And it's typically a small monthly amount. So for example, my parents only pay like a $20 a month per person, but they get a lot of enhanced coverages that they wouldn't get if they just had A and B. Things like they would get some prescription coverage. They wouldn't have that with A or B. They have vision coverage. They have some minimal dental coverage and health and wellness programs. They get their wellness checkups done. Typically, they have to pick a plan doctor that's in that network. And it's like I said, it's a very small monthly fee. Sometimes it's even less than $20 a month. Sometimes it's a bit more. And you can choose to get in and out of any Medicare Advantage plan at any time before December 7th. So once a year, you get to opt into any new plan that you choose if you don't like the one you're with. The one thing I would mention, just how Medicare Advantage plans, they really are similar to healthcare plans, which we haven't covered yet, but an HMO is a managed care plan. You guys have heard of, health maintenance organization or an HMO. And this is where you actually have to pick a primary care physician. They're kind of your gatekeeper. They keep you and tell you which specialists and refer you to them to go to them before you actually get approved to go to that specialist. And then you pay your out-of-pocket copayment or coinsurance. If you were decided to go with a PPO, you have a little bit more flexibility. You can see generally any doctor that's in your network as long as they accept Medicare patients. So a little bit more flexibility than you would with an HMO. Some plans I'll just mention are not available in every city, so you have to be cautious of that. I'm not going to go through the other type of Medicare options that are out there, but just be aware. So you have other choices with the Medicare Advantage plan. I do think it's something worth looking into if you're ever assisting any of your family members. It's worth looking at as an enhancement to Part A and B. So some people can add on those things. Like I said, you have to be really careful because sometimes you're only covered in certain counties. Not every part of the state would be covered in each plan that's available. Part D is a special piece that you definitely don't want to do without. And when I talked about Medicare Advantage, a lot of those Medicare Advantage Part C actually have Part D rolled in with them. So you don't have to pay an additional fee. And not all of them. You can choose to not have Part D, or you could choose to do something separate for Part D. But sometimes you get all of the parts by just doing a Medicare Advantage plan. So Part D would be the part that covers your drugs. So it can be a standalone plan or it can be rolled in with a Medicare Advantage plan, but you pay potentially another monthly premium. And where this comes into play is if you have specialized drugs that do not qualify under Part C or the Medicare Advantage plan you picked, you could actually add on an enhanced package, pay an additional fee. It does provide at least a standard level of coverage. Although it doesn't cover every type of drug. So you have to be really careful. And this is the one that you have to probably shop around the most for. So if you're on a specialized drug, let's say you have a heart condition or kidney failure issues, you probably need to see what drugs you're on. Of course, drugs can run anywhere from hundreds of thousands of dollars a month. So you need to see if they're a covered drug that's on the plan that you pick. And there actually is some gaps in coverage with the standard Part D program, unfortunately. So let's just go with these dollar amounts, just give you examples. So typically you have to meet an annual deductible just like you would any health plan like your parents might have. You have to spend a certain amount out of pocket. And in this example, let's say this was in $2012, but it's probably not much more. Typically you would spend money up until you got to your deductible. Let's say it's $500. So you'll spend money up until $500. Once you hit that deductible, then you're going to start having coverage up until you get to, it doesn't give an amount, but let's say it's $3,000. That's where your coverage stops for a period of time. So from $500 to $3,000, your coverage is going to continue to protect you until you hit that amount. We call this the donut hole or coverage gap. This is where your drug costs have to be completely paid out of pocket by you after you get to this level. And then after you hit the extreme amount, let's say it's $5,000, it's probably been elevated since 2012. Once you've spent a catastrophic amount on drugs during the year, let's say it's $5,000, then your coverage is going to start picking up again. So you have some gaps in that coverage, and if you have a lot of money that you're spending in drugs, it can help enhance, but you're still going to have a lot of out of pocket. In order to protect yourselves, Medigap coverage is something that people buy. This is completely different, and that it is like buying something that covers everything. It's like the full warranty plan. Anything that can go wrong, it's going to cover it. You never have to pay a dime out of pocket. Obviously, it comes at a very high expense. I know my in-laws have bought this type of coverage, several $100s a month, several $100s that they pay out of pocket just so they don't have to pay a $20 copay when they go to the doctor. I still think you need to do a cost analysis to decide is it really worth it. If you're a very unhealthy individual, it may be worth it. And obviously, the older you get, the more expensive it becomes. So what's the overall impact of the Affordable Care Act or Obamacare? Obviously, things have been kind of pulled back a little bit, but really what was the overall impact or intent of the impact? So some provisions of the Affordable Care Act did have some impact on Medicare. They did provide some of the rebates on the coverage gap in Part D or for prescriptions. They did kind of really come down on healthcare fraud. I know you always hear about cases where doctors are being found guilty of Medicare fraud, where they file fraudulent claims to collect money. They do provide more preventative care. So now people do have access to free wellness. They get access to gym membership for free. They're trying to get people more active. And so they have added some benefits that they wouldn't have had otherwise if they hadn't put this into place. And it definitely helped reduce some of the extra payments being made to Medicare Advantage plans. It kind of shored them up. Other thing is that it is helping to improve the healthcare quality, eliminating unnecessary readmittances to the hospital, helping cut down costs where possible, and then bundling payments. So if you pick a Medicare bundle or a Medicare Advantage plan, it bundles a lot of your expenses, vision, dental, prescription drugs, all into one payment, and kind of makes it more simple for you. Maybe make a once-a-year payment to cover your expenses, the majority of your expenses, I should say. So there are some problems with OASDI, primarily being that it is going to run out of money based on the current financial issues. So having the combined trust funds, they say that all of it together will probably exhaust funds by 2033. In order to carry it beyond that, so if we were to look at 2033 in the future, it's only going to have enough money to fund about 75% of those benefits that are scheduled to be paid out. So it's a significant cut in what people would get. If we actually wanted to pay out all fully scheduled benefits over the next 75 years, we would require almost $8.5 trillion in present value dollars. And we also know, it says the Disability Income Trust Fund is projected to be exhausted in 2016, which obviously we're 4 years past that and it still exists. So obviously it's either gotten federal funding to protect it, or it's continuing to be strung out a little bit longer. But either way we look at it, there is a definite financial shortcoming in OASDI currently. The deficit could be reduced. There are some options that are being looked at, and every presidential candidate brings up these different options. They could increase payroll taxes. They could decrease the benefits to retirees, which is never a popular decision. They could provide more of the federal government's general revenues, help pay for the benefits, but either way, we're all going to pay for that. That means everybody's going to pay more taxes, whether through income or sales tax or other, or some kind of combination of those solutions. Also, you could do a progressive index to determine benefits. So maybe if you have more income, you may get less of a benefit, which necessarily isn't fair either, but most social insurance is not. You could increase, like I said, the payroll taxes for both employees and employers, but if you increase taxes for employers, all that's going to do is cause them to hire less people. We already have some of those economic challenges today with Obamacare requirements and mandates. And then you could move up waiting longer periods for people to retire beyond age 67, which people do live longer, so it may be a feasible option since we live longer. And then some of the other proposed changes, reducing benefits for future retirees across the board. You could just draw a line in the sand and say from this age on, you're going to get less money, and other people are grandfathered in. I don't know where that is, but you need to give plenty of warning to the individuals that are not going to be protected. You could increase the higher income individuals. Like right now, after you make over $130,000 a year, they typically stop taxing your wages for OASDI, but they could continue to increase taxes on the high income individuals. It's an option. They can make more Social Security federally taxable. Instead of paying no tax or a limited amount of tax, you may have to pay taxes on everything you get. There's a lot of different things out there, or they can invest in more private investment options, which they don't today. They probably would earn a higher interest rate, which help fund the overall trust. So if you really were to look at some of these solutions and what percentage of them would work, you could either reduce benefits. There's 4 options. The biggest impact would be using a progressive index to reduce benefits for future retirees. Or to increase revenues, you obviously can increase taxes or tax more people that get the benefit. The biggest impact would be raising payroll taxes, but like I said, that would actually be a negative impact on the economy as well. So Medicare crisis, obviously, I'm gonna stop there, and we will pick up with some of the other options going, some of the other solutions out there in the second part. I will see you soon.